hang on. Yes?
All right, cool. I was gonna say. All
We're
right,
all-
everybody.
Yes, we're live.
Dr. Garrett Weegrup here at Pure Plastic Surgery for another edition of Thursday Thoughts. Today we're going to be talking about something a little less on the actual technical surgical side, and we're going to be talking about the emotional impacts of having breast surgery and what kind of impacts that can have on you. So first of all, we need to think about the different types of breast surgeries that women can have and the reasons they may be getting those. So starting off, some people are getting breast surgery for not fun reasons at all, cancer being one of those. So reconstructive breast surgery is one of the most important things that plastic surgeons do, and a very important part, a very emotional journey for those patients that are going through that. It's very taxing and trying to, when you're going through your initial treatments and possibly mastectomies and other difficult surgeries. And it's a really rewarding part of our jobs as plastic surgeons to help people with the reconstructive process of that, to get them back to feeling normal and themselves again. But even the more cosmetic type procedures that we do on a regular daily basis, something as simple as a breast augmentation, isn't all just pure cosmetics. It can be done for many different reasons. And like most of the patients I operate on, everybody has some degree of asymmetry from side to side. One side can be larger and smaller. So just making you feel more comfortable in your own skin by getting a breast augmentation where we can make that more even, or feeling more comfortable without your clothes on, is a very valuable thing that we can offer patients. And then people that are undergoing surgery after having children and just trying to restore their youthful look of their breasts going back to prior to children, after you have that deflation and the sagging, and getting them back to a point where they're just feeling more comfortable and more themselves is a big part of what we do. And one of the most rewarding procedures that we do for women are actually breast reductions, believe it or not. People who have struggled with very large, heavy breasts their entire lives. It's one of the highest patient satisfaction procedures we can offer is a breast reduction. People have a ton of relief after dealing with it for a lifetime of having heavy, large breasts, feeling light, free, able to go for a run without everything bouncing around. So it's really quite the gamut of emotions that we can go through helping people improve their lives with different types of breast surgery. So with all that being said, does anybody have any questions about breast surgery or anything else related to plastic surgery?
Yes, Doc. First, the echo. What's my fault? Sorry. Okay. Is it true that with a pencil can I know the tosses of my breast?
So that's the pencil test, and what people are talking about when they say that is if you can lift up your breast, put a pencil under there, and it holds your breast, how much sagging or ptosis you have over your breast. And yes, if you can hold a pencil down there, you probably do have some degree of breast ptosis or breast droopiness. But the thing that we really use to identify that level of droopiness and how we grade it as physicians is looking at the fold of your breast in relationship to where your nipple is. So if your nipple is at your fold, that's grade 1 ptosis. If it's below your fold, that's grade 2 ptosis. And if it's pointing down towards the floor, that's grade 3 ptosis, and that's the most extreme ptosis that you can have of your breast. So pencil test is not my favorite test for that, but can be used.
Okay, this question. I'm 74 and I'm too old for surgery.
You're not too old for surgery, and you could definitely get surgery. But in our office, in our elective setting, as an outpatient office-based surgery center, it's not a good idea for someone who's 74 years old to do that here at Pure Plastic Surgery. I'd recommend you doing that in a hospital setting so you can be under closer monitoring, and if you ever develop any issues under anesthesia, you'll be there for that.
Okay, Doc. Should I wait until I'm done having children to have augmentation?
So, if you have near-term plans to have children, yeah, I would recommend that you hold off having a breast augmentation until you're done having kids, because the procedure that you may want to have is different than the procedure you may need. You may need a lift with an augmentation. But if kids are in the distant future, not something you're planning on in the next year or two, if you want a breast augmentation, get a breast augmentation. You'll still be able to breastfeed, and we can address any further issues that you may have post-pregnancy in the future.
Okay, doctor, do you only do breast surgery for Cheryl?
For what?
Oh no, that's the name of it. Cheryl. If you do breast surgery, only breast surgery.
No, I do surgery all over the body, but my main focus is on breast and body procedures for both men and women.
Okay, somebody asked if is that the same for a BBL? I think for the age thing could be the age part.
For age, yes, also for sure age, and then also BBL at 74 years old. We are doing it on older and older people, but 74 years old, I don't know if the challenges with that surgery would be worth the reward at that age.
Okay, how do I choose my new size?
So your new size is chosen on a few different things, and first of all, it's based off of your anatomy and your measurements, and then second of all, it's based off of what your goals are. So after I determine the proper size footprint of the implants that we have, depending on your level of augmentation that you're seeking, we can go with a higher profile implant to get you that more full look.
I'm excited for my surgery with you next Thursday. I couldn't be in better hands.
Awesome.
Congratulations,
Take care
Dad.
of you on Thursday.
Okay, the question about the BBL was in regards to having children. So, how she should wait after having children to have a BBL?
So a BBL is even, I would say, less related to having children. You can still have the same changes with your body after having children, whether you have the BBL or not, which can be laxity of your abdominal wall or abdominal wall stasis, and loose skin that may need to be tightened in the future, which is typically treated with a tummy tuck. But if you want a BBL before or after pregnancy, it really doesn't matter.
Okay. Will augmentation work for me if I feel my breasts are sagging?
If it's a very mild level of sagging, breast augmentation can fill up that volume and quote unquote lift the breast a little bit just by filling up the deflated volume. But if your nipple is truly below the fold of your breast, you're going to need some type of a breast lift procedure in combination with the augmentation.
And doctor, the last question I have, but not least, how do I choose my new size?
How do you choose your new size? We kind of just went over that a minute ago, and it's based off of your goals, your anatomy, and your measurements, and the discussion we had during the consultation.
This is the patient that's coming next week. She asked this, is a way to get the BBL in a most natural way without looking so much different? Just thinking loud.
For sure, and that's one of the things that I think me and both of my partners here at Pure Plastic Surgery is our goal is not these extreme exaggerated results, but subtle improvements of your own natural beauty. And getting a natural result is an important part of having a great long-lasting result with the BBL. So it's toning down the midsection and then gently augmenting the buttocks to get better shape, projection, but not overdoing it to make it look cartoonish.
Okay, Doc, this is a comment and says, Brazilian women love your work.
I love the Brazilian woman. Thank you guys. All right, everybody. Please come back, check us out at pureplasticsurgery.com and book a consultation with me. Have a great day.